how to fix the top 4 penis problems. Hey there, in this video, I'm going to be covering the 4 top problems that men tend to experience with their penises and how to fix them. I'm going to be covering premature ejaculation, erectile dysfunction, delayed ejaculation, and Peyronie's disease. So I'm going to talk about what each one of those is, what the causes are, and of course, how to fix it. Now, this is going to be a short form video here on YouTube. So I'm going to go a little bit quick on some of this, but I did an entire hour-long podcast episode covering these and then some. I included a few more problems that people tend to have, and that is a podcast episode called Penis Problems, Penis Solutions. It's linked in the comments below, so go check that out if you want a deeper dive into these and if the problem that you're potentially having isn't in this video. But before I do that, please make sure that you like, share, and subscribe. Doing so greatly helps the channel. Every time that you like a video, you share it, you subscribe to the channel, these things all tell the Google algorithm that people are interested in this content and that they want to see more. So doing so really helps me out, helps grow the channel, and helps people get information they need to make their relationships and their sex lives better. I am Kevin Anthony, and I am a certified sexologist, Tantra Counselor, NLP Practitioner, and sex, love, and relationship coach. And for over a decade, I have been helping men, women, and couples have the relationship of their dreams and the best sex of their lives. Okay, I'm going to start with erectile dysfunction. So what is erectile dysfunction? Well, that is the inability to get or keep an erection long enough for sex. I think we all know what erectile dysfunction is. So what are some of the things that can cause erectile dysfunction? I'm going to actually have to read this to you from my notes because it's kind of long. So you have health issues such as heart disease, clogged blood vessels, high cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, Parkinson's disease, multiple sclerosis, and there are actually even more than that. That's not necessarily the short list, but it's an abbreviated list. So health problems. One of the things that a lot of men don't realize is that an early warning sign of heart disease or other conditions such as I just read is the inability to achieve and maintain an erection. So one of the things I always tell men when I'm working with them and they are experiencing ED is very first thing, go to your doctor, get checked out, make sure that your health is in order. Because a lot of times men have no idea that they have something like heart disease, and they just think, oh, I'm having erectile dysfunction, and then they go to their doctors to get checked out, and the doctor's like, whoa, okay, we've got some things that we need to fix here. So good that you came in, right? So that's the first thing. Health conditions can cause it. If you're experiencing erectile dysfunction, go see your doctor, and then fix that if there is a problem, or at least you can rule it out if there isn't one. Okay, let's keep going down this list here. We have prescription medications. That is a known side effect for quite a few prescription medications. So another thing that I always ask clients when I'm working with them in regards to erectile dysfunction is, what medications are you on? We get a list of them. We figure out which ones have this as a possible side effect. And then we have to have them go back to their doctor and say, hey, doc, I'm on this med. This is what's happening for me. Is there a way that we can maybe reduce the dosage or wean off of it or switch to another medication that doesn't have that side effect? That is really important. Tobacco use, that's another one. The reason why tobacco use is really on this is because it can cause coronary artery disease. So it can cause some of the health problems listed earlier. We have Peyronie's disease, which I will talk about later, which is some scar tissue inside the penis, sleep disorders, prostate cancer treatments, or simply an enlarged prostate, surgeries or other injuries that affect the pelvic area or the spinal cord, low testosterone, depression, anxiety, or other mental health conditions, stress, and relationship problems such as poor communication, or just basically, dysfunctional relationship. So those are some of the things that can potentially cause it. So then, okay, what do you do to fix it? Well, I'm just going to go over them real quick. Like I said, this is not a deep dive, but just to give you an idea of some of the things you can do to fix it. Obviously, work with your doctor. If it's any of those health concern issues, work with your doctor and see if you can get those taken care of. It could be fixing a particular health problem or learning how to manage it, such as diabetes or heart disease or other chronic health conditions. Obviously, stop smoking, avoid alcohol, drug use, things like that. All those things are negatively affecting your body's ability to perform the way it was meant to perform. Exercise regularly. This is really huge. This will actually stimulate the production of testosterone. It also will help the health and improve the quality of your circulatory system, which your penis and ability to get erections is part of that system. So exercising regularly, reducing stress, getting help for any anxiety or depression or mental health issues you might be having. Here's one that I like to talk about, which is find out what is in the way. So I would say that the overwhelming majority of clients that I work with when it comes to erectile dysfunction don't have anything physically wrong with their body. Some do, but most of them don't. It's usually more of a psychological, emotional issue that's getting in the way. So when I say find out what's in the way, that's what I mean. Like, we got to find out what that block is, what the thing is that's getting in the way. Sometimes it's performance anxiety. Sometimes it's trauma from the past. It could be a lot of different things. So we want to find out what's in the way and then work on removing that. We can't talk about erection issues without mentioning porn use. An excessive use of porn can create problems like erectile dysfunction and also premature ejaculation and performance problems. So porn use is something that has to be looked at. If you are using porn, especially if it's excessively, it's something that you would need to stop at least for a while until you can get your body back on track. Change your mindset. This is really big. I talked about how, finding out what's in the way, and I said a lot of times it's psychological or emotional issues. So we got to really work on fixing the mindset that goes along with it, your confidence in the bedroom, right? Fixing your diet. This is another thing that's really important, making sure that you really tune up your diet and really get healthy with that, because that's going to support the healthy functioning of your body. You want to train your pelvic floor muscles. So I defined at the beginning of this that erectile dysfunction was the inability to achieve and or maintain an erection. And so you have to allow blood into the penis, right? And so there's valves that have to open, you have to pump blood into the penis, but then they have to close and hold the blood in the penis. So another thing that you can do is train your pelvic floor muscles. So you can really work on training those. That can really help you maintain a strong erection. And then, of course, there are newer treatments and therapies out there, things such as shockwave therapy and platelet-rich plasma. There are penis pumps that you can use in combination with things like shockwave therapy and PRP, which is the platelet-rich plasma. So there's newer technologies to help facilitate that can also get your body back on track. And so that is sort of the very quick nutshell of erectile dysfunction, a list of many of the things that cause it and some of the things that you can do to solve it. All right, the second major penis problem is premature ejaculation. Now, depending on what you read, some will define it as ejaculating in under a minute. Some will say ejaculating in under 2 minutes. The reason why they do that is because they say the average man only lasts, 2 to 7 minutes, right? And so they say, well, a premature ejaculation must be less than 2 minutes. Personally, I think premature ejaculation is really ejaculating anytime before you actually want to. And again, talking so many times on this channel about how long it takes a woman, 20 to 30 minutes to potentially reach an orgasm. You can see that, honestly, in my opinion, premature ejaculation is you ejaculating before she has an orgasm. So you need to last significantly longer than 2 minutes, in my personal opinion. Having said that, what are some of the things that potentially cause premature ejaculation? Number one, hypersensitivity. So you have something where you are hypersensitive in your genitals, and that stimulation is basically more than you can handle, and it will trigger an ejaculation really quickly. There are potentially some issues like body chemistry, high thyroid, low brain serotonin, low testosterone. So there's some potential physical things that could be happening there. Muscle tone of the pelvic floor, that's another one. So, how strong are those pelvic floor muscles? And not just strength, but how good of control do you have over them? Because you can actually use those pelvic floor muscles to delay an ejaculation. Health issues such as chronic infections, prediabetes, diabetes, neurologic disorders, trauma, and or surgery. So those are all things that can contribute to it. Oh, and of course, one more, psychological issues. So those are some of the things that can potentially contribute to premature ejaculation. I would also add to that list, and I didn't write it down on my list, so it's not in my notes, but I would add to that porn use. Porn use is something that tends to teach men how to ejaculate quick, because the reality is that what do most men do? They spend 20 minutes looking for the right clip. Oh, this is the one for today. And then, in less than 5 minutes, you masturbate to it, ejaculate, you're off and done and going on to the next thing for your day. And so that actually starts to train your body to ejaculate quickly. So those are some reasons why you may be experiencing premature ejaculation. All right, so how do you fix it? Well, you want to fix any health issues. So any of those things that I listed before, you want to make sure that you are addressing those and working with your doctor, as well as doing your own work outside of that to address those health issues. If you are using porn, especially if you're using it in the way I just described, then I would highly suggest that you abstain from that for a while until you can retrain your body and get back on track. I would say also to use what I call the mindful masturbation practice, and that's something that I teach in the Master Your Ejaculation course, and also with my clients, which is a practice to help retrain your body. I don't have time to go into it here in this video, but it's a practice to retrain your body to be able to last longer. You want to make sure that you are also looking at any underlying psychological issues. So that can be, past relationships, performance anxiety stuff, trauma. There's a lot of things that could potentially be under the surface. Like I said earlier, these are things that I tend to see a lot with clients that I'm working with. Always have them go to the doctor first, and then, if they come back with a clean bill of health, or they come back with, okay, I'm working on this, what else, can we do? We almost always find something underneath the surface. You can also learn breathing practices that can help you lower your how stimulated you are, your arousal level, right? So that's something that you can work on as well to help control your ejaculation. And then, of course, learning to really control your pelvic floor muscles. So you want to tone them up, you want to strengthen them, and then you want to learn how to control them. So those are all things that you can do to solve your premature ejaculation problem. Now, again, having that knowledge is one thing, and that's great, and I hope that you can take away from this video some of those things and actually create change in your life. But it's also difficult, so don't be afraid to take the Power and Mastery course, or hire me as a coach. I will walk you through this, step you through this. We will take you on a journey. We will help you solve these problems. I have helped more men than I can count get their sex life back on track and really get either to sexual mastery or well on their way to it. So if you're needing help with these, for sure, get in touch with me. All right, the next one is delayed ejaculation. Some things that cause that: age, low testosterone, drinking alcohol, medications, infections, nerve issues, lymph node surgery or testicular cancer, depression, unrealistic expectations, performance anxiety, and concern about pregnancy. One thing you should notice as I'm talking about these penis problems, you see a lot of the, under the what causes it section of each one, a lot of the same things, right? And you see that a lot of them do have to do with both your physical health and your mental health. So it's really important to understand that both of those things directly impact your ability to use your genitals and be sexual. Okay, so what can we do to fix delayed ejaculation? Well, you can strengthen your pelvic floor muscles again. Now, I know that seems a little counterintuitive. You're like, but I thought that was to control ejaculation. Well, yes, but it is actually improving the function altogether of your penis. And so that's something you can do. Learn relaxation techniques and breathing exercises. One of the things that you really need to do is relax. It's a very important part of learning how to control your ejaculation, is to learn to relax. And a lot of times what men do is they get so much performance anxiety that it either sends them over into a premature ejaculation, or it prevents them from getting an erection or ejaculating when they want to. So you can see how the same cause can cause either end of the spectrum in problems. And so therefore similar techniques can help you solve them. You want to make sure that you check your testosterone levels. That's another important thing that you can do. Low testosterone could potentially be an issue here. Obviously, look at any medications you're taking. You want to make sure that you have really realistic expectations. Again, I think sometimes men just put way too much pressure on themselves, whether it's, to perform or, to have that ejaculation, which, ejaculating is great and it feels wonderful, but it's not essential to have great sex. You can still have amazing sex and not have an ejaculation. I mean, this is a whole huge foundational piece of Tantra, at least the sexual part of Tantra anyway. And so you can really have amazing sex without it. So things that can calm you down a little bit, but also shift your expectations about what has to happen during sex. And then, of course, as I've mentioned with the others, work with a coach. So, when it comes to whether it's erectile dysfunction, premature ejaculation, or delayed ejaculation, these are all things that I work with men on. So if you need help with them, for sure, look me up. You can find links to all that in the description. I'm happy to help you solve this issue. Okay, and last penis problem for this video is Peyronie's disease. So Peyronie's disease is a disorder where there is scar tissue in the inner lining of the penis, resulting in penile deformity, pain, and sometimes erectile dysfunction. Okay, so what are some of the things that cause it? Well, there is an association with, I can never pronounce this, Dupuytren's contractures of the hand, which is a disease of collagen that has a genetic origin. So there is a possibility that that could have something to do with it. But most likely, what I see most often is some sort of genital trauma. But then there could be some issues as a result of prostate surgery, and also diabetes. So those are some things that can potentially cause Peyronie's disease. I would say I haven't worked with a ton of men with this, but I have definitely worked with men with this. And I've seen that it's either genetic or most often actually trauma. So then, of course, what can we do to fix it? All right, the first thing that you can do to fix it is if you do have what's called a penile fracture, right? And this can happen. This can happen in sex. This can happen from rough masturbation. This could happen from an accident where there's trauma to the penis. You want to have that addressed right away, because if they can fix that before the scar tissue forms, then you can hopefully avoid having any complications or issues after the injury. There are some potential oral medications and or injections that can help. There are technologies like shockwave therapy. In some cases, they might be able to do some surgery. I've also heard reports of success with mild cases of massaging castor oil in it because it does help break up scar tissue. So those are all things that you can potentially do to help with Peyronie's disease. If I could impart anything about Peyronie's, and you'll often see with Peyronie's where the penis will curve to one side or the other in some awkward way, or it'll feel hard and stiff even when it's not erect in certain places. If I could impart just really one thing to you is you don't necessarily have to live with it forever. Usually what I hear from guys is, I didn't think there was anything I could do about it. There are things that you could do about it, and I would strongly suggest that if you are dealing with that, to go seek the help from a really good urologist who has experience using some of the latest technology in solving this problem. All right, there you go. There are 4 common penis problems, what causes them, and what you can potentially do to solve them. I hope that you found this helpful. And as always, if you want to find out more about me and the other things that I'm up to, or any of the programs that I mentioned during this video, go to kevinanthonycoaching.com/link in bio. Links to the programs that I mentioned, the Power Mastery programs are in there, and my podcast and my coaching programs and everything else are right there.